go.
Hi, you're probably wondering why we're here in the back hallway of Alternative Healthcare Solutions. And this month's Clinical Pearl, I want to talk to you a little bit about a technique you can show a patient to increase their shoulder range of motion. Most of us know a little bit about tight pecs, tight traps, and tight levator scapulae when they're involved in something called upper cross pattern of inhibition, where it pulls us into bad posture. So we naturally do corner stretches, or sometimes even these door frame stretches, trying to get the person to stretch out their chest. The problem with this is it's not very dynamic. They have to stretch here for a little bit, slide down here for a little bit, slide down here for a little bit. So if the person's got fairly normal shoulders and they don't have a lot of shoulder pathology and cartilage damage, you can think, well, why don't I just take myself a towel and I can kind of grab the towel and I can do these things that we called in school dislocates, although you're really not dislocating, but a lot of patients just don't have the range of motion in the shoulder to do that. So you say, well, what else could we use? Well, a kinder, gentler way to do it would just be to take a TheraTube or a TheraBand. And they take it and they do this, and it doesn't pull them nearly as far, but it gives them a little bit of resistance. And once they get comfortable with doing this and making a more dynamic amount of range of motion for the shoulder, see, well, that's pretty easy. All they do is cheat up, and now they got a little bit more stretch going on, and they can keep taking tighter bands or shorter bands and gradually progress out to increase what I like to call a more dynamic shoulder range of motion, and they can take it with them.